Um, so I'm going to talk really about primary care and net zero, what it means to us. So my background, I'm a GP. I live in Yorkshire. I work just over the border in Darlington. But as part of that, I've also been off and done another degree and another master's in environmental management. And my real passion, the thing that actually gets me up on a morning, is planetary health and helping or finding ways for primary care to reach net zero. Because of that, I run my own business as well. And so I do sustainability, I do carbon literacy, as you will hear in a moment, carbon footprinting of practices, carbon reduction plans for practices, but I also do it for other businesses as well. But obviously, because of what I spent my formative years at medical school, healthcare is really that place for me to go to start with. So please put any questions in the chat box, and I will try and answer them either here or by emailing people afterwards. Why should we become carbon literate? Well, as climate change and carbon emissions are really increasingly dominating public discussion and becoming household terms, it's easy to assume that we're all au fait with these concepts. But one of the beauties of carbon literacy training is that none of those assumptions are made, and it really is an opportunity to get to grips with exactly what climate change means and why it's so important. So I feel that as a GP that, my training equipped me with the skills that I needed to prevent ill health or diagnose illnesses, provide treatment, care for the sick, or hold the hands of the dying. And to do that, we've always had to, in healthcare and primary care specifically, fight for our piece of usually limited resources. And when we do get those resources, we can't really afford to be profligate with them. And so to be able to practice sustainably, we need to have the correct skills. And those skills, in my opinion, include knowing about carbon literacy and becoming carbon literate. And really, becoming carbon literate helps us to understand that the efforts of every individual is needed to reduce the carbon emissions to tackle climate change. Now, I can tell you about polar bears dying in the Arctic, but I'm not going to do any of that, because actually there is a much, much, much bigger prize at stake. So the UK has pledged to, has made pledges to address the climate at the moment. And if we met our minimum pledges that or our minimum commitments that we've already made, what would that look like? Well, roughly, give or take, the UK's death rate is about 500,000 per year. The Lancet calculated that if we met our minimum commitments, that 125,000 lives that are currently cut short or wasted would be prevented by meeting those individual commitments. And so that's by 2040, a quarter of the deaths could be avoided. And this is through better diets, more exercise, reductions in air pollution. And actually, if we went a little bit further and focused on just the health gains from addressing the climate, that gets closer to 150,000 lives in the UK every year. And of course, there are reports coming out almost daily on the health benefits of addressing the climate change, whether it be reducing ill health in our patients or reducing the number of exacerbations that they have, reducing the number of GP admissions, the disease burden, the hospital admissions. There is a real health prize from tackling this. But what does that actually mean locally? Well, as I say, I'm a GP in Darlington. We've got a population of about 100,000 or so. In an average year, we have about 1,350 deaths. And in the last 12 months, I checked this last week, we've had 225 deaths from COVID in the last 12 months. And I suspect that for each of the places that you work at the moment, you would be able to get a very similar figure. We've had a public health report out in 2019, which said that air pollution in Darlington is responsible for 49 deaths a year. So every 4.5 years, we lose as many people in Darlington. Their lives are cut short because of air pollution alone. But I haven't seen the £37 billion that was spent on track and trace being spent on reducing air pollution, even though within a few years, the figures are not going to be dissimilar. If we looked at the Lancet figure of the 25 deaths, well, for Darlington, if we tackled climate issues and the public health around that, that's nearly 340 deaths a year. Now, to me, it's a bit of crackers that we've spent so much on COVID,
and we could argue rightly so. But if we don't then put something similar, a similar figure of money into something which is even bigger. So for those of you who were here at for the earlier bit with Phil, this is what the definition of carbon literacy is. It's an awareness of the carbon cost and impact of everyday activity. So this is in our individual lives, but also in our working lives. And it's the ability and motivation to reduce those emissions. So for me, this is more about taking action. It's about learning about the topic, but it's understanding the actions that we take as individuals and organisations and how to reduce those and lessen our harmful impact. For the, oh, I think I've slipped a slide there, sorry. By the end of doing a carbon literacy course, there are two actions that need to take place. One is that you submit, two things that you need to do. One is to submit an action for personal footprint. One is to submit an action for the practice footprint. So there's only two things that you come out of this with. It's a pledge to reduce your footprint as an individual and your footprint as an organisation. But of course, is anybody else talking about carbon? Is it just me talking about this? Well, pleasingly, no, it's not. The Greener NHS was launched in October of last year and has set a target for the NHS of net zero by 2040. It's recognised that really the health and social care system in the UK is responsible for about 5% of the total emissions. And of course, the footprint of the NHS is going to be made up of its constituent parts, as we'll see in a moment. The NHS as a whole generates about 25 million tonnes of carbon dioxide equivalent every year. And we in primary care, it's about 5.75 million tonnes. Now that's 20%, that's a significant proportion. But in my opinion, actually, I think that the Greener NHS overlooks the contribution from primary care and really focuses far more on secondary care. But a phrase that we'll keep coming back to is that to reach overall net zero, all parts are going to need to reach net zero. So how does the carbon literacy course work for healthcare? Well, it's split into three sections. The first is about science, and it covers the background of climate change and climate science. The second is about the impact, where we look at the impact around the globe, the vulnerability of different countries, including the effects that we're going to see on the UK. We look at the legal position from the Climate Change Act, for example, the different greenhouse gas emissions from different sectors, what has been achieved so far, but also what challenges lie ahead. And of course, there's specific information on primary care, GP practices and the health service overall. And then the final section is probably the most important, and that is about taking action. And this goes back to those two pledges. One is the individual action pledge and one is the group action pledge. I'm not going to go into the science right now. This is a screenshot of changing global temperatures from 2013. We can see that it is really quite unequal, and as a result, we know that there's not going to be an equal impact across the globe, across the world, either globally or nationally, from climate change. Oops, apologies. We know that there are going to be effects of rising rising heat. There's going to be water events such as flooding or weather events such as storms. But actually, one of the things that the carbon literacy course does is it helps it take it to a local level. I don't know how many people are on here from Humberside at the moment, but this is a flood map or a projected flood map for 2050. So people keep saying that, we need to do something about the climate for our kids and our grandkids. Well, not if you live in Hull and you're under 80. This is going to affect us, and it's going to affect us in our lifetimes. I don't mean this in quite the way that it sounds, but it's not all about the kids, it's about us as well. So if any of your practices are in that red area, and if you go into Climate Central, there's flood risk maps or sea level rise and coastal flooding maps. I see stories in the press on a frequent basis about people from who live in Hull who are still flooded out of their homes a year later, and the impact on their physical and mental health of our patients, our staff, our families and our communities. I don't know how many are on here from Leeds at the moment, but we can get street level data on air pollution. This is a map. The one in the middle is from 10 o'clock this morning, and it's looking at the A61, which is one of the northern roads out of Leeds. And I can see what the air quality is
today in terms of nitrous oxide and ozone. For example, we know that nitrous oxide concentrations affect children's educational ability. There are lower outcomes at GCSE if you live in an area of high air pollution. So this is something which, we as individuals, as GPs, but also as society, really, I think, need to be aware of. The map, the diagram on the right is air quality over a month. And so, of course, this is November last year. We can see that there's quite a hot spot around bonfire night, November the 5th. But I'm not actually sure what was happening in Leeds on the weekend of the 27th, when there was a second peak. I don't think it was Diwali. I'm not quite sure what that was, but we can use this sort of data to really highlight the importance of improving air quality. Why is this important? Well, of course, about 18 million patients in the UK go to a GP practice in an area which exceeds the World Health Organization's air pollution limits. So they visit the practice in poor air quality areas. We work in those practices. So it's us and our staff that need to be aware as well. Just a quick note, at the bottom of the screen is a web address for the Royal Society of Medicine, which has started a course of lectures, webinars in the last week on the role of health professionals in climate change, which I would recommend. So please screenshot it, or this is being recorded so you can have a look back at it later. We know that there are going to be a lot of impacts of the climate change on human health, whether it be the temperature and the effect on A&E attendances, the death rates from cardiovascular and respiratory diseases. We know that crime levels go up, violent crime particularly in higher as areas get hotter. We know that flooding and the mental health problems, we know air pollution and respiratory problems, and so on and so on. But of course, we in healthcare are going to be on the front line again. So, carbon literacy course looks at the sources and hotspots of carbon within the health service and primary care. This is from the Lancet, showing all 25 million tonnes of emissions and the 5.75 million tonnes from general practice. We look at primary care specifically and the split between clinical and non-clinical carbon, so that we need to have a look at each of the areas individually to be able to reach net zero overall. So one of the things that the course will help people to do is to look at where the hotspots are and what practical things can be put into place between the practice staff, or at PCN level or at CCG level, to be able to help overcome these. And then, of course, it's action. So do we want to save money? Do we want to save energy, or do we want to save carbon? Well, of course, they're all the same thing. So we can save all of them simultaneously. Do we want to improve patient health, or save money, or save carbon? Well, guess what? We can do all of them simultaneously. So this, for example, is thinking of respiratory diseases. Anybody who takes or is prescribed 3 or more salbutamol inhalers each year doubles their risk of an exacerbation. We know that Ventolin inhalers have got a high carbon footprint. So for me, it's not just about switching from MDIs to DPIs, it's about looking at the whole respiratory pathway. Can we stop people from needing as many SABA inhalers because we've got better maintenance? So we can look at the non-clinical and clinical. And for me, this is really just a first step in a slightly bigger journey. So becoming carbon literate is number 1. We can then look at carbon footprints of practices. We can then look at carbon reduction plans. And this can be done, as I say, either at individual practice, PCN or CCG level. Please screenshot this if you would like. So of course, I'm here as part of Speak Carbon. So whether the carbon literacy is done through Speak Carbon or through myself at C Sustainability, honestly don't mind. The UK HACC has got a useful guide to carbon literacy. It's free, just click on their website. Centre for Sustainable Healthcare has got a course on, sustainable healthcare. There's the Carbon Literacy Project, which Phil has mentioned, and then there's other resources such as the Green Impact for Health, and out of Sheffield, there's the fabulous Greener Practice, which has got a huge amount of resources and webinars for GPs, practices and staff, and really well worth looking up. Nearly there. So the course is a day's worth of carbon literacy learning, as Phil pointed out, but we do this in a hybrid, so you can do it in your own time and then come together for an action planning workshop with either the practice or people from elsewhere. It's £100. You can start it today.
And there's my email addresses. And I think I'm about to be out of time and kicked out of this room in 50 seconds time. I hope that that's a good overview. I do rush it a bit because I can talk for 57 hours straight on this. So I do tend to go a little bit off topic. I will save the chat, and if there's any contacts, I will try and sharing the slides. I'm more than happy to do so if you send me an email to either of those addresses. Absolutely looking at energy systems in practices. Yep, we can certainly talk about that, not a problem at all. 17 seconds to go. But yeah, please email me. I am more than happy anytime to talk about carbon sustainability until your ears fall off. My wife gets sick of me, so I think that she would value a different set of ears. Bye.